Hello everyone. The topic of our study is clinical and urodynamic characteristics of female blood outlet obstruction accompanied with interstitial cystitis or blood painful syndrome. My name is Cao Fengqing. It's the disclose as I found it by myself. Blood outlet obstruction, a common lower urinary tract symptom for females. The International Continence Society defines it as a generic term for obstruction during voting. It's a reduced urinary flow rate with a simultaneously increased detrusor pressure. However, in clinic, we found that some blood outlet obstruction patients with several storage symptoms like urgency, frequency, even blood pain, and they were diagnosed accompanied with interstitial cystitis or blood painful syndrome finally. So, we want to investigate the difference of the clinical and urodynamic characteristics between the blood outlet obstruction with or without interstitial cystitis or blood painful syndrome. We set a retrospective study and collated the data by reviewing the electronic clinical records and urodynamic charts from the consecutive patients. There are 4 terms about the inclusion criteria. More than 18 years old, with electronic clinical and urodynamic data, with blood outlet obstruction diagnosed based on history, voting cyst ureterography, and cystoscopy, with interstitial cystitis or blood painful syndrome diagnosed based on the glomerulations. All the operations performed by same experienced surgeon, and the patient would be excluded if the clinical or urodynamic data was incomplete or with mental disorder. The patients without interstitial cystitis or blood painful syndrome who matched age and the length of symptoms as the control group. And we compared the demographics, length of symptoms, and the lower urinary tract symptoms like urgency, frequency, blood pain, and nocturia. After calculating the blood outlet obstruction index, obstruction coefficient, and blood contractility index, also the maximal flow rate, detrusor pressure at maximal flow, maximal systometry capacity, first desired void, strong desired void, and post void residual were compared. As the chart shows, we reviewed 192 electronic data and 37 patients were enrolled based on inclusion criteria. After excluding 11 because of incomplete data or mental disorder, a total of 26 patients were included in the study finally. Another 26 patients without interstitial cystitis or blood painful syndrome, matched age, and the length of symptoms were set as control. After statistics analyzing, there was no significant difference in age and the length of symptoms between the 2 groups. As the table 1 shows, the patients in blood outlet obstruction accompanied with interstitial cystitis or blood painful syndrome had a significant higher proportion to experience frequency, blood pain, and nocturia. By contrast, the presence of urgency between 2 groups was not significant. As the table 2, in terms of the urodynamic characteristics, the patients with blood outlet obstruction accompanied with interstitial cystitis or blood painful syndrome had significant higher blood oversensitivity with a lower first desired void, strong desired void, and maximal systometry capacity in comparison with controls. However, there was no significant difference between 2 groups in the maximal flow rate, detrusor pressure at maximal flow. The patients with pure blood outlet obstruction seem to have a higher blood outlet obstruction index, obstruction coefficient, and blood contractility index, but no significant compared to those with interstitial cystitis or blood painful syndrome. In this study, we found the presence of interstitial cystitis or blood painful syndrome might be associated with more severe storage symptoms and higher blood oversensitivity, which may mainly stem from reduction of blood compliance secondary to interstitial cystitis or blood painful syndrome. Moreover, also no significant difference was detected between 2 groups. Patients with pure blood outlet obstruction seems to have a higher blood outlet obstruction index, obstruction coefficient, and blood contractility index, which indicated these patients may have more severe obstruction. but the small sample size may weaken the significance of difference. In other words, the presence of interstitial cystitis or blood painful syndrome symptoms may contribute to the diagnosis of blood outlet obstruction even with less severe obstruction. So we get the conclusion. The presence of interstitial cystitis or blood painful syndrome in patients with blood outlet obstruction may cause a more severe storage symptoms and higher blood sensitivity. In addition, the presence of interstitial cystitis or blood painful syndrome may be helpful for patients to detect their blood outlet obstruction. That's all. Thank you for your watching.